Welcome everybody to our webinar today with Dr. David White. We're going to be talking about a new cryosurgical product, the Histofreezer FLEX, and also relating the use of this product to his practice each day as a pediatrician. And so, Dr. White, we want to welcome you to the webinar. You're with Maryland Farm Pediatrics near Nashville, Tennessee. And let's start a little bit perhaps with your background and some about your current practice at Maryland Farms.
Okay, I originally from Texas, attended college at Texas A&M and medical school at University of Texas in San Antonio. Did my residency at Vanderbilt, and I've been practicing pediatrics for 22, 23 years now. Most of that's been in the Nashville area. I did spend a year in North Carolina, and then the last 4 years I was in near Bozeman, Montana. So, but back here in the Nashville area, and I'm in a medium-sized private practice called Maryland Farms Pediatrics, which is in a suburb, and we've got 4 pediatricians.
Mm-hmm. So on a day-to-day basis in the treatment room, what kind of issues are you seeing? Again, remember the conversation here is between you and other pediatricians who may consider this modality. So it's, you know, treated as you're speaking to them and some of the things that you see and also they may be seeing.
Yeah, well, I think in general peds, there's not a ton of procedures like there are in some specialties. On average, I probably do 1, maybe 2 procedures a day total. It might be repairing a laceration or draining an abscess, something like that, removing a foreign body from a nose or ear. But because it's not every day, I kind of enjoy doing procedures. It's something I look forward to. It's kind of a break from all the infectious diseases that I deal with all the time, day in and day out. So it's nice to be able to use my hands.
Yeah. So, okay, so let's segue then to some of the things that are related to perhaps the use of cryosurgery, the lumps and bumps, the warts, molluscum. How often are you seeing these? Are they seasonal, certain age groups or activities? How do they come into the practice?
Yeah, I mean, I see common warts and plantar warts at all ages. Molluscum tends to skew younger for sure. I actually see warts quite a bit if you combine common and plantar warts with molluscum. Not every day, but probably every 2 days, I will see somebody with warts. Sometimes it's the reason that they came in and they're here for treatment, but often they're at their checkup and the mom will say, "Oh, by the way, she's had this thing on her foot for 6 months. It's been killing her." And so it's kind of a incidental note, but it's sure enough, she's got a big plantar wart that needs treatment. And but it's probably every 2 to 3 days that I'll see warts, and often I'll be able to provide treatment for it.
So what are the options for treating it that you generally consider?
Before I do anything, I always go over options with the parents, and I always give them the first option, which is to do nothing. And there are times when if you wait long enough, the body's immune system will eventually take care of it. But often by the time they're in the office, it's been going on long enough that it's probably time to step it up a little. And I'll tell them the over-the-counter products that are available, most of them the salicylic acid treatments like Compound W or Duofilm, something like that. And then I'll also offer cryotherapy. And then in some cases, I'll offer a derm referral if it's something like really extensive or subungual or on the face, somewhere where I'm not as confident, and I'll offer that. But most lesions I'm very comfortable treating. I've done it enough times.
Right. And in using cryosurgery, then you've done this for a long time, I take it?
Yeah, I started practicing in '98, and so I'd say I've been using the original Histofreezer. I mean, since I started practice, it's all I remember using, and I've been very happy with it. So I don't know how many thousands of treatments I've done, but I've done a lot.
Right. And outcomes generally acceptable, or any caveats in the way you might perform a cryosurgical treatment for a plantar versus a common wart?
Well, the plantar warts being deeper, the freeze time I think needs to be longer. Um, those will require a second treatment, certainly more often than a wart on the palm of the hand or on the elbow or something like that. But I feel like my success rate is really good. I think patients have been pleased and parents have been pleased.
Yeah. No, and I bring it up because, of course, talking to other clinicians, everybody always wants to know whatever best practices or helpful hints, anything like that
Yeah,
along the way. So feel
yeah,
free to sprinkle that in.
yeah,
And,
absolutely.
and so the Histofreezer original product that you mentioned has been around since the early 1990s. It's a standard of
Hmm.
care that's been around a long time, and many have used it and love it. It's just part of standard of care. But now let's start talking about the new generation, the Histofreezer FLEX that's been introduced. How did
Right.
you come to use it, and tell us a bit about what you've been doing with it?
Yeah. So I only became aware of it because I contacted your company to get some extra 2 millimeter the foam tips for the original histofreezer, because in pediatrics I do a lot of small lesions, and your original histofreezer comes with 2 millimeter and 5 millimeter tips, and for getting in between toes or tiny molluscum on children, I just used a lot of the 2 millimeter, so I had run out. And so I contacted your local rep, Joel, here in Tennessee, and he was able to provide those for me. And he asked if he could demonstrate a new product. And I was like, okay, yeah, he's bringing me the tips. I'll let him demonstrate. And it's quite a bit different. I think it's way more than a generation 2 histofreezer. It's not like there's some improvements. To me, it seems like a complete redesign, complete rethinking of how cryosurgery is implemented. So there's a lot of thoughtful engineering that goes into it that's not evident when you first look at it, because probably like me, most general pediatricians are very happy with the Histofreezer. It works, it's easy to use, it's fairly precise, and our outcomes are I've been fine. So I don't think anybody's been realizing that there's more to offer, and I think you guys have done it. It's really impressive. And the more I looked into it, and I watched some instructional videos on YouTube, and the more I kind of dove deep into what it has to offer, it's really impressive. There's lots of cool features.
So let's dig into that a little bit. So the original Histofreezer has, as you said, these foam buds. They're saturated with the cryogen gas that gets cold, and then you apply it for a certain number of seconds to freeze the
Mhm.
lesion. With the
Right.
new Histofreezer FLEX, FLEX meaning that there's two ways to use it. There's an applicator or bud, and then there are these cones. Now, to some, what we've learned over the years is there are some physicians who have used cones for much of their practice life, and others have used buds. Now,
Right.
if you're an original Histofreezer user, you never used cones before. So maybe tell
Right.
us a little bit about that experience, and for those who have never done this before.
Yeah, so I've got a set here. So I mean, this is what the Histofreezer Flex looks like. Um, these are the cones. I don't know if you could see
Hmm.
that, but they come in different sizes and ranging from 3 to 12 millimeter, like 3, 5, 7, 9, 12. I've only been using the 3 and 5s because with peds, it's just things are just smaller, I guess. And then this is the adapter that the cone fits onto, and then of course it fits onto the machine like this. And the adapter, it's really more than an adapter. I mean, yes, it holds the cone, but the two of those combined kind of serve as the reservoir for the cryogen as you're waiting for it to evaporate, which usually takes 45 seconds or so. But what's interesting about these cones is that unlike the prior Histofreezer where there was just the foam tip, and you were kind of doing your best to stay within the margins that you wanted to be in and to get a real uniform freeze. These cones, it makes it to where you always do a uniform freeze. So your kit comes with a little card that shows different size lesions. So if you need some help figuring out what size cone would be best, that can be helpful. But what's great is that you can really have precise freezing. And then another thing that I learned from watching some of the YouTube videos that I didn't know before is that it's actually good to have a really tiny margin of healthy tissue frozen, as well as the wart itself. I'd always just tried to avoid healthy tissue at all costs, but I've learned that you're actually supposed to include a little bit of that in your margins, and that results in better outcomes. So to me, this is a great advancement over the foam tips that we had with the old Histofreezer. Even though that worked really well, there is a little bit of when you're charging it, there was a little bit of drippiness sometimes. Like I wouldn't feel confident that the tip was fully charged until it would drip, and that's just kind of a waste of cryogen. You know, you're limited by the sizes of those two buds. There's a little bit of splattering sometimes, and so anyway, what's revolutionary about this is just how uniform, and you can see it once you're done freezing the lesion. You can just see how perfect your freeze is, and it just looks great. And I also think it results in better outcome because we know exactly the amount of cryogen that they're getting based on how long you charged it, like 3 to 5 seconds or so, depending on how much you want. And so that's been very different for me than what I've been doing.
That's a great overview and guidance for other clinicians. One question related to that: do you tend to use the cones on everything now, or plantar warts in particular? Where do you put that firepower?
Yeah, that's a good question. It's probably different for an internist or other specialists, but in pediatrics, it's about half and half for me. When you're using the cone and the cone adapter, the unit does have to be upside down and on a fairly level surface. It really won't work like this. And so it needs to be upside down on a fairly level surface, and you have to have a kind of a cooperative patient. And we don't always have that in pediatrics, which is more akin to veterinary medicine sometimes. And so if I have a 2-year-old who's really freaked out to be there and she's already crying and cowering, then I'm not confident that she'll be able to hold still even for 45 seconds because it does sting a little bit. And and then also if it's in an area where it's just going to be impossible for me to have her hold it level, it's something that I have to do like this, then I won't use it. And then the other factor is just their fear level, because I know we'll talk about the buds next, but there's definitely a less intimidating factor to these buds that I've learned to use to my advantage, and I think it works really good and everybody leaves happy.
Well, that's a perfect segue. So we talked about the cones and how they can be really effective. The other way with Flex is, of course, these buds. So why don't you talk about how you've been using them a little bit more and the advantages they've brought?
Yeah, so once again, this is the machine. So we take off the adapter. So the bud fits on without the adapter, and it goes on just like that. And then to charge it, you hold it upside down and press the trigger for 3 to 5 seconds, and that charges it. And you can use it directly by holding this, but what I do is take the bud off of the machine because it holds that charge. And what's cool, I don't know what you guys used in this material, but it's not foam. It holds a lot of cryogen, and it does so without dripping or splattering. So that's really, really nice because it holds it for a long time. So I can remove it from the kit, and I can treat things upside down. I can treat little kids in between their fingers, in between toes. I can and I can kind of hide it in my hand, and they don't even really see what's going on. So it kind of takes out a big fear element that is a big challenge in pediatrics with younger kids, and sometimes teenagers too. And so not only am I able to hide this and have it be non-intrusive and not scary, but I do other things to try to distract them. When I know I've got about 30 seconds left, I'll have them count down with me. I try to use that time to teach people what causes warts and dispel a bunch of myths. I don't know if it's just a Southern thing, but everybody thinks those are seeds and warts. And if you dig out the seeds, the wart goes away. And I tell them, no, those are blood vessels. Don't dig out the blood vessels. And most parents don't realize that. And I'll often bring up Charlie and the Chocolate Factory, because if you remember the very annoying character of Veruca Salt, that's where she got her name, and most kids have seen that. And so it's just enough to buy me enough time to get through this without it being too traumatic for the child.
Yeah, you could. Well, I feel like I just took my child in to visit their pediatrician in this conversation, so that's perfect. Yeah, that calming effect, and then having in the Histofreezer FLEX this option to do either approach makes sense. There was one other thing that you had brought up when we first met about the Histofreezer FLEX and your thoughts on this, and that is about it being better for the environment. And this is a little bit different and a side-related issue, but maybe you could speak to that a little bit.
Yeah. So when you get the kit, it comes in a big box, and one of the things that your company has done is made it possible to return the empty canisters in the box that it came in, and it's got a pre-addressed paid for label, so those canisters can be refilled. And when I first learned that, I was impressed, and I was impressed because I would have never noticed had you guys not done that, because it's just normal for us to dispose everything in medicine. So I wouldn't have noticed. But the fact that you guys did do that and took the time, and I'm sure there's cost involved in that, to make it something that's returnable and therefore reducing medical waste, I think speaks highly of the integrity of the company and your willingness to kind of be a pioneer in that area, in the environment.
Well, it's great of you to point that out. Again, for all the other clinicians that may look at this, this is just an example of all of us trying to be good stewards and take care of those things, and not be putting more cans into the landfill, but rather have a way to use them. And I think as all of this moves forward, we're going to see more and more companies trying to take a stand in the way that they be responsible with their products, but also teach on some of the new techniques. As we get to closing, are there any last statements you'd like to make, to your colleagues about using the product and cryosurgery in the practice? I think you had mentioned that when we met, that some of your colleagues in your current practice weren't using cryo at all, and you sort of brought it in with you.
Right.
How has that worked out?
It's worked out well. They of course tried it out on themselves and tried to freeze off every skin lesion that they had on their own arms to get used to the new kit. But I think they quickly became firm believers, and then they would watch me do a few treatments to kind of learn the technique, and now they're very confident in it as well. And so now all four of us pediatricians at Maryland Farms treat warts regularly.
That's great. That's great. Well, Dr. White, we want to thank you for your time in doing this webinar. Again, we know you have a busy practice, busy life, and to share with others, especially in pediatrics, of the help that cryosurgery can bring and the difference in the designs of the Histofreezer FLEX compared to what historically has been kind of a sleepy area. So again, Dr. White, thanks so much for your time today and insights. Again, we appreciate that, and be well. Thank you.
All right. Thanks, Sam.
Hi, this is Dr. David White. I want to spend the next 60 seconds talking about the Histofreezer FLEX and the bud option. Let's look close at the bud. This is what it is. It's basically a wick that holds cryogen. The way you charge it is you simply screw it onto the top of the canister. Now you're ready to invert the canister. And there's the trigger. You pull the trigger for about 5 seconds. So 1, 2, 3, 4, 5. Notice there is no splatter, no drip. And then you're ready to roll. You can treat warts this way, this way, this way. It doesn't matter the direction that you hold the canister. And the coolest thing for a pediatrician like me is that you can remove the bud, put the canister away, and I can walk into a room and I can treat a child's warts without scaring them, because I can hide this in my hands and I can really get in to the web space between their fingers or on their toes, and it's not so frightening. Makes them a little bit more cooperative. Parents are happy. I think it's a better first-time result. And for the next 60 seconds, I'd like to teach you about the Histofreezer FLEX when used with cones and cone adapters. Let's take a closer look. This is what the cone adapter looks like. It's primarily a reservoir for the cryogen, and then this is the actual cone. These come in different sizes, 3, 5, 7, 9, and 12 millimeters, based on the size of the lesion that you're wanting to destroy. The way it works, you attach it to the canister, invert it, place it right on the lesion, and then you're ready to pull the trigger for 5 seconds. I'm going to hold this close so you can see what happens. So 1, 2, 3, 4, 5. And you can see how cryogen is filling up that closed system. And the beauty of this is that it gives a real uniform and a real deep freeze. I think it's very effective, and it's really shown to have better first-time outcomes. So the treatment is done when the cryogen stops bubbling. And so it usually takes about 45 seconds. We're pretty close to that point now. I wanted to share a few tips and tricks I've learned along the way, specifically as it relates to these treatment buds, which are these little guys. Now, when you order a kit, you get 50 of them, and they come in these 10 packs that look like this. They have these thoughtful little windows along the packaging, kind of like a gun magazine, so you always know how many you have. Using them is very simple. You screw it onto the top, and with a single hand you invert the canister and hold the trigger for 5 seconds. After 5 seconds, the bud is fully charged, minus 67 degrees Celsius. The canister does not get cold, the handle does not get cold, nor does the plastic around the bud. So you can either hold this canister any way you want, any direction, treating a lesion, or what I like to do in pediatrics is take the bud off and hold it by the plastic. Now remember, this holds the charge for 2 minutes, and so you have a good bit of time to work with. I can put the canister out of sight and kind of cradle this in my hand, and I can be talking to a child, trying to make them laugh, just distracting them, and so they're more cooperative, and then that helps me do a lot better job. Now the other cool thing about the buds is that you can trim them down to size if you need a smaller bud. So the tip on this looks to be about 7 millimeters to me, and say I'm doing a 2 millimeter lesion in a child's web space on their hand, and this is just a little bit big, and so I can just trim it if I want to. So I keep a sharp pair of scissors in the kit, and whenever I need to, I usually do 2 cuts like this. 1, 2, and now I've got a 2 millimeter tip. And then I charge it as usual, and even though it's been trimmed, I've learned that it doesn't drip, it doesn't splatter, and it still holds that cryogen for around 2 minutes, and I can treat these smaller lesions. So I think that's been a great asset. The other thing that I found is helpful is that I do some of these in advance, Because in pediatrics, so often I'm treating small lesions. I've learned that I'm going to need these, so why not just do a dozen in advance? That way I don't have to spend valuable patient time getting a bud ready. You know, there's so much to like about the Histofreezer FLEX. It's got a very thoughtfully engineered handle that just fits a hand nicely. It's got striations on the side so that you can have a firm grip. This trigger pull is very comfortable and natural feeling. You have the ability to use the whole thing single-handedly. I like the fact that the canister and the handle don't get cold. And then of course you have the flexibility and treatment tips with the different cones and buds available. But one other special feature of Histofreezer FLEX is that it's environmentally friendly. And that's because CryoConcepts has gone the extra mile to make it super easy and free to return your empty canisters. Each kit comes with a prepaid return address label, and when your canister's empty, you put it in the box it came in and send it back, and they take care of the rest. I think this is such a good reflection on the integrity of CryoConcepts that it makes me like the Histofreezer FLEX even more.